We've got about 2 more minutes, and we'll wait and see if anyone else is going to join us. We'll go ahead and get started. Okay, we'll go ahead and get started, and thank you for joining me tonight. I do want to let you know that I'm recording. So I'm going to pull up our NCLEX questions, and I literally have about 80 questions. So we'll go through those. I intentionally threw in some of the questions that you probably won't know, or that you may say, I don't remember that. Even though it has to do with kind of neuro things, because I want to, in addition to looking at how do you answer questions that you know the topics, how are we going to figure out the answer to questions that maybe we're stumped at? And that's going to happen on NCLEX. You're not going to recognize every single disorder or question, but how can we rule out some of the things by looking at the keywords in the question? So we'll do that as well. I'm going to go ahead and share my screen. Okay, can you all see my screen with my practice questions on it?
Yes.
Okay, good. Okay. So for this question, it's a select all that apply. I know that's your favorite, so we're going to practice some of those. So our first question says, a nurse in the emergency department is monitoring a client who has a cervical spinal cord injury from a fall. The nurse should monitor the client for which of the following complications? So in this, what I'm looking at, and I'll let you guys look through the answers, but I see a number of answers, and the first thing that I see when I look at the answers is some of them are an increase of things, some of them are a decrease of things, but they're all assessment items. Okay. So what do we know about spinal cord injury? What I think about is if there's an injury to the spinal cord, it is kind of a pathway, a message center that takes messages from the brain to parts of the body, but also to parts of the body back to the brain. And if there's an injury, there's an impairment in that message center. So what happens is our body has a decrease in the ability to perform some of the functions that it does. So when I look at this, a decrease in the messages that are getting to and from the brain. Hypotension would be a decrease. What about polyuria? Is that an increase or decrease? Okay, so that's an increase, so that would not be correct. Hyperthermia is an increase. That wouldn't be correct. Absence of vowel sounds, that's a decrease. That would be correct. And weakened gag reflex, weakened, so decreased. That would be correct. So when I look at answers, I try to think, is there a pattern? Is there a pattern of something going on that makes some things different than the other? And so with this, thinking about the spinal cord, those messages are decreased. So other things we would see would be urinary retention. We would see weakened muscles or paralysis of muscles. We would see slowed or slurred speech. We could see a lot of those different things depending on the severity of injury to our patient. Okay. So the next one I put in here is a priority question. And so we would do all of these things, but we're going to do them in a different order. Nurses conducting a primary survey of a client who sustained a life-threatening injury due to a motor vehicle crash. Identify the sequence of actions the nurse should take. So for this type of quiz, you had to move the boxes, but we're just going to kind of number them based on the letters, which comes first. So if I look at the responses, I see when I read them that some of them are an assessment. So performing a Glasgow Coma scale, establishing an IV access, opening an airway, determining the effectiveness of ventilator efforts. Okay, so we're assessing the respiratory effort of a patient and removing clothing. So I also think in prioritization, the ABCs, airway, breathing, circulation, and safety needs. Okay, so what do you think, reading through all those things, if we are coming to aid and for someone in a life-threatening injury, what are we going to do first?
C, open the airway.
We're going to open the airway. Right. We're going to open the airway. What do you think we do next? If we've opened the airway, then what do we need to assess as well?
Determine effectiveness of ventilator.
Yeah, so determine the effectiveness of their respiratory effort, their ventilator effort, right? So how well are they breathing once we've opened that airway? Okay.
Establish.
We'd establish an IV access, right? So we want to be able to give medication, and we would do that no matter what the result of a head to toe would show or something like that. Okay, we establish an IV access. Then we got two things left. What do we do next?
Perform a Glasgow Coma scale so we know if they've got head injury, so not to move them.
Right. We're going to perform a Glasgow Coma scale assessment, and we can do that very quickly. Eyes, verbal, movement, our EMV, and we're going to determine what the extent of their injuries may be. And then lastly, we'd remove their clothing for a thorough assessment. Yeah, very good. So like I said, I look at the answers, I look at them, I see if there's something in common, if there's something, if I'm doing something in order, is it based on prioritization? Could be a number of things. It could be, like we said, the ABCs, airway, breathing, circulation. I throw safety in there too. Is there something that's going to keep my patient safe? It could be based on Maslow, right? It could be based on, I just thought of something else. I'll come back to it. I'm sure we'll get another one. Okay. All right. So 3, a nurse is caring for an adolescent client who has newly applied fiberglass cast for a fractured tibia. Which of the following is the priority action for the nurse to take? Okay, so first we have to know what a tibia is, right? So where's the tibia?
In the leg.
Right, lower leg, right? So if we are going to follow priority action again, by reading through those things at the bottom, what do you think we'd do first?
Perform a neurovascular assessment.
Why?
You want to make sure that your blood flow is not being compromised.
Yes, we're assessing for a complication. And I also look at those answers and I say, which one's an assessment, which one's an intervention, which one's an evaluation, And assessment, if we're talking about prioritization, always comes first, right? All right, great. A nurse is completing discharge teaching with a client following an arthroscopic knee surgery. Which of the following instructions should the nurse include in the teaching? Okay. So we have to think about arthroscopic knee surgery. Okay. What does arthroscopic mean?
Joint replacement.
Yeah, so we're talking about the joint. Okay. So which instruction would we need to give a patient? What do you think about remaining on bed rest for 24 hours?
No, we want them to ambulate as quickly as possible.
Right, we want to get them up. We want to prevent complications. Keeping the leg in a dependent position.
Elevate. Don't
Right, we want to encourage edema. What about applying ice to the affected area?
Yes. To prevent.
Yes. Okay, what about begin active range of motion?
Yes, we would, but not immediately.
Yes,
You'd do
you're right.
passive
Right.
range of motion, wouldn't you?
Yeah. So active range of motion would be them doing everything themselves. And so in the beginning after joint surgery, we're going to have some passive range of motion. We want to have movement. We want to encourage movement, but the patient isn't going to be total weight bearing after that surgery. And some of that's going to be passive. So thinking about what we would do, how we avoid complications, applying ice is going to be our priority because that's going to decrease edema and pain to the area. Yeah. Nurse is assessing a client who sustained a basal skull fracture and notes a thin stream of clear drainage coming from the client's right nostril. Which of the following actions should the nurse take first?
Test it for glucose.
Why would we test for glucose first?
To make
Because
sure
that's spinal fluid.
Right. And if we think about one of the options is notify the physician. Well, we want to have as much information as possible to tell him, right? So testing the drainage for glucose is going to be important, and having that information to tell the physician when we call him, because he's going to say, well, did you test it? All right, good. Nurse is caring for a client who has returned from the surgical suite following surgery for a fractured mandible. The client has intermaxillary fixation to repair and stabilize the fracture. Which of the following actions is the priority for the nurse to take? Okay. And even if I read this question, even if I read it and I was like, I don't know what an intermaxillary fixation is, if it says, what's the priority for the nurse to take? What do you think the priority is?
prevention, so prevent aspiration.
Right. If we look at those things, if they're all interventions, what do we hope to achieve from that? We don't want our patient to aspirate, so we would have A. Great. A rehab nurse is caring for a client who's had a spinal cord injury that resulted in paraplegia. After a week on the unit, the nurse notes that the client is withdrawn and increasingly resistant to rehabilitation efforts by the staff. Which of the following actions should the nurse take? I'll let you read through those.
D,
Why do you think D?
because if we utilize them in planning, it could be something that feels more attainable to them and they're more in control of the situation.
Right. They've got to have ownership of those goals. And so we think back to the nursing process. It is collaborative. So it's not us making it and telling them what to do. It is us educating them about the disease process, the rehab process, but planning that care and setting those goals with the patient. Yeah, very good. Nurse is caring for a client who's undergoing a lumbar puncture. Which of the following is the priority action for the nurse to take to maintain privacy for our client?
Pull the curtains.
Why pull the curtains?
Because even if somebody walks in the room, they're still going to be covered.
Yes, yes. Because so if we look at these, we're like, well, I mean, they all seem plausible, but if we pull the curtains, we're still able to access everything on their body. And if you've ever been in a room and somebody swings that door open, everybody in the hallway can see everything. So pulling the curtains around the client's bed. All right. A nurse is caring for a patient who has Parkinson's disease and is taking diphenhydramine. I thought I'd throw some meds in here. Which of the following therapeutic outcomes should the nurse expect to see? So with therapeutic outcomes, we're looking at what is the benefit of taking that medicine?
Decreased tremors.
Why'd you say decreased tremors?
Not being completely familiar with the medication, I'm looking at what we're treating, which is Parkinson's, and that's one of its major effects is tremors.
Yes, yes, that's exactly right. Decreasing tremors. So in the question, we can look at diphenhydramine, and that's actually Benadryl. But with Parkinson's disease, if we think about the signs and symptoms of Parkinson's disease, one of the things that we hope to do, decreasing tremors. Very good. We know we couldn't delay disease progression. If we knew what that medicine was for, we'd know it wasn't for depression. And it actually has kind of some anticholinergic effects that could cause a little bit of urinary retention. So it wouldn't improve bladder function. But yeah, so thinking about Parkinson's, decreased tremors. Nurses caring for a client who has a new diagnosis of myasthenia gravis. For which of the following manifestations should the nurse monitor? So thinking about manifestations, thinking about signs and symptoms. Did you guys talk about myasthenia gravis?
Yes, ma'am.
Okay, okay. I thought you did, and I put it in there, and I was like, I'm not sure.
It's weakness, isn't it?
Weakness, yeah. Yeah, so generalized weakness of the diaphragm, the intercostal muscles can produce respiratory distress, predispose the client to respiratory infections. A nurse is caring for a client who had chemotherapy-induced peripheral neuropathy. The nurse should expect the client to report having experienced which of the following symptoms? So that's talking about the peripheral neuropathy.
B, tingling feeling in the extremities.
Yes, tingling in the extremities. So kind of numbness and tingling would be a interruption in the nerve pathway. And if you want me to slow down or you're still reading or something, then just yell at me and let me know. A nurse who's caring for a client who has had a stroke involving the right hemisphere. Which of the following alterations in function should the nurse expect?
B.
Yeah, so inability to recognize family members. And NCLEX is they really like right and left hemisphere. And so we could rule out right hemiparesis because we know that if there's an injury on the right hemisphere, it would affect the left side of the body. And so knowing kind of what type of injuries are associated with the left and right hemisphere. Nurse is planning care for a female client who has a T4 spinal cord injury and is at risk for acquiring urinary tract infections. Which of the following actions should the nurse include in the client's plan of care? So they've told us about the urinary tract infection. So I'm thinking that the actions would have to do with urinary tract infections.
Offer the client the bedpan every 2 hours?
Would
Well,
it be B?
A, clean the perineum from, well, no.
No, no, no. Okay, encourage more fluid. I was just thinking if they have a spinal cord injury, maybe they weren't going as well, so you want them to go more often. I don't know. So encourage fluid intake.
It's encourage fluid. So if we kind of go from A to D, cleansing the perineum, we'd want it front to back. Anytime that we're thinking about putting in an indwelling urinary catheter, that's probably not the answer, because that encourages urinary tract infection. Even if this patient can't pee, we're going to in and out cath him. We're not going to put in an indwelling catheter. D, offer the client the bedpan every 2 hours. These clients probably, like we said, if they're talking about a spinal cord injury, may not be able to pee. So we'd probably be in and out cathing them, but we'd want to keep them hydrated. So encouraging fluid intake. Nurse is assessing a client who's receiving 1 unit of packed red blood cells to treat intraoperative blood loss. Client reports chills, back pain, and client's blood pressure is 80/64. Which of the following actions should the nurse take first?
Stop the infusion.
Stop the infusion. Always stop the infusion. Yes. All right. Nurse is caring for a client who has a Jackson-Pratt drain in place after surgery for an open reduction internal fixation. The nurse should understand that the JP drain was placed for which purpose? Why do we put a drain in?
A?
A, to drain fluids.
Yes. To prevent fluid from accumulating in the wound. Yes. So it could cause pressure. It could also build up bacteria. So we put that in the joint space anytime a patient has a joint replacement, to be able to provide a light, consistent suction to pull that fluid out of the joint. The nurse is caring for a client who's scheduled to have an MRI. The client asks the nurse what to expect during the procedure. Which of the following statements should the nurse make?
D.
Is it D?
It's D. Yeah. MRI is noisy, be allowed to wear earplugs. MRI does not, we don't use contrast dye. Okay. It is distorted by movement. Okay. And it depends on how extensive the process is and what they're scanning to determine how long it's going to take. So it's something that we know consistently is that it's noisy and they can wear earplugs. Nurse is teaching about risk factors for developing a stroke with a group of older adult clients. Which of the following non-modifiable risk factors should the nurse include in teaching?
D.
Race.
D, race. Yeah. So even picking up on some of those non-modifiable, going back and what I do, if I read a question and I look at the answers and say, they're all right, then I haven't read the question right. So going back and picking up on maybe a word that I missed. Nurse is in a client's room where the client begins having a tonic-clonic seizure. Which of the following actions should the nurse take first?
A.
A. Why A?
To prevent choking.
Yeah, we want to prevent aspiration, right? Yeah, so think about, why are we doing it? What's the rationale? Right, good. The nurse is reviewing the laboratory findings for a client who developed a fat embolism syndrome following a fracture. Which of the following laboratory findings should the nurse expect?
Is it A?
It's A, decreased serum calcium level. The rationale I have says that it is expected, although the reason is unknown. So we just remember that, the decreased calcium level. Nurse is caring for a client who's unconscious and has a breathing pattern characterized by alternating periods of hyperventilation and apnea. The nurse should document that the client has which of the following respiratory alterations.
Cheyenne Stokes.
Yep, the Cheyne-Stokes respirations. Yes. Kushmal will be described as an expiratory period longer than inspiratory. Strider would be a high-pitched squeaking sound coming from the trachea. And apneistic respirations would be long extending periods of apnea. Yeah. A nurse on the medical surgical unit is caring for 4 clients who are 24 to 36 hours post-op. Which of the following surgical procedures places a client at risk for a DVT?
The hip.
The hip, yes. Anytime we're going into that joint capsule, they're more at risk for a fat embolism, for a DVT. Yes. A nurse is assessing a client who's in skeletal traction. Which of the following findings should the nurse identify as an indication of infection at the pin site?
Warmth.
So in this one, think about, it's talking about that the infection is due to an open area. But think about all of those things as what would be a normal finding in a patient and what would be an abnormal finding in a patient. Do you think serosanguinous drainage would be normal? Yeah, it's normal. So we think about that kind of bloody, clear. If they had any drainage, that would probably be normal. It's not purulent, right? Mild erythema. So they would probably have some mild bruising around where they put the skeletal traction in. And if we think about warm skin, what's the alternative? Hot or cold? Warm's okay. So a patient that has a fever would be the one that is most indicative of an infection. And I think when it says infection at the pin site, because when I first read it, I thought, I'm looking at the pin site and looking for infection, but I think it's talking about why they had the infection. So that would be fever.
Dr. Lowe, for ones like that, would you suggest that we just once we see fever, we just stop, or infection, we just stop after that and don't read the rest? Because to me, I would think that that would be a systemic symptom and not a localized.
Right, and it doesn't say localized.
Kind of infection.
It doesn't.
It just made it seem like because it said at the pin site. So should we just stop reading after we see infection, you think, or?
Well, I would think looking at it, unless it specifically says local or systemic. What's an indication of a local infection or a systemic infection? If it just says infection, I would go through each of those and determine, is this normal or abnormal for my patient with this condition?
Okay, thank you.
You're welcome. Yeah, and warm, they like to use warm a lot. So warm is normal. Okay? If it said reddened or edematous or hot to the touch or something like that, that's going, to abnormal. But warm is considered normal. Nurse in an emergency department is caring for a client who had a seizure and became unresponsive after stating she had a sudden, severe headache and vomiting. The client's vital signs are as follows: blood pressure 198/110, pulse of 82, respirations 24, temperature of 100.8. Which of the following neurologic disorders should the nurse suspect? Okay.
Is it hemorrhagic?
It is hemorrhagic. Why is it hemorrhagic?
Well, the nausea and vomiting, and then it kind of put me in the mindset of increased cranial pressure.
Right, right. So I would think that as well. So looking at those symptoms, sudden severe headache, vomiting, unresponsive. We've got elevated blood pressure, temperature's elevated. And especially, you know, what I think is I look at that temperature and think, I wouldn't think of these other ones having a temperature, an elevated temperature, but with increased intracranial pressure, you would. Yeah, very good. Nurse is caring for a client who has expressive aphasia following a cerebral vascular accident. Which of the following parameters should the nurse use first in order to assess the client's pain level? So what is expressive aphasia?
More they can understand, they just can't speak or articulate.
Right, right. They're having difficulty expressing. So their point, their side of getting information across to you. So of all those things there, which of the following parameters should the nurse use first in order to assess the client's pain level?
Self-report, because you can still use the pictures and just have them point because they understand.
Yeah. So if we look at the other ones, they are behavioral indicators, which we would use if someone's maybe unconscious or couldn't communicate at all. Scheduled treatments and client's illness would us again be interpreting for that patient if they have pain, but they're still able to express in other ways. So we could still use a self-report pain scale and even get them to point to something. Yeah, very good. A nurse enters a client's room and finds the client is on the floor having a seizure. Which of the following actions should the nurse take?
B.
Yeah, place the client on his side. I think we have one similar to this. They just reworded it. So we don't ever want to put something in the client's mouth. We don't need to hold their arms and legs from moving. We want to place them on their side versus their back for aspiration. And what we would do is if there was something in their way, like a table or something that they could harm themselves on, we could move that object out of the way. So we're most concerned about aspiration. Yeah. A nurse is caring for a client who sustained a femur fracture in an automobile accident and is placed in skeletal traction. The nurse may remove the weights from the traction device if which of the following occurs? What do you think would trump?
A life-threatening situation.
Yeah, yeah. So thinking of all those we're not supposed to remove weights, but what would be like the thing that would make us? So if they developed a life-threatening situation and we had to remove them to, I don't know, get them on a hard backboard or do compressions or something like that. Yeah. Nurse is assessing a client who reports numbness and pain in the right palm, index finger, middle finger. The client reports working with a keyboard most of the time. The nurse suspects carpal tunnel syndrome. Which of the following tests should the nurse request that the client perform?
Would it be B?
Why would it be B?
I don't know. I'm just thinking if they have carpal tunnel, they're not going to have full range of motion.
Yeah. So having that, when I read that, I thought working with a keyboard, thinking about the things that they do at the keyboard that causes that nerve compression. And so thinking about what would elicit that in them. And so holding the wrist at that 90-degree flexion is going to be something that would elicit that response. Yeah. Nurses at a rehab center is planning care for a client who had a left hemispheric cerebral vascular accident 3 weeks ago. Which of the following goals should the nurse include in the client's rehab program?
A.
C. Less
Yes,
is language.
it's
and logic,
A.
isn't it?
It's establish the ability to communicate effectively. And I was looking through those responses and thought, well, we could rule out D automatically because if they have a left-sided CVA, improving their left-sided motor function wouldn't be one of our priorities. So again, thinking about what's controlled left versus right-sided, and that left would be ability to communicate effectively. Nurse is assessing a client who has a fracture of the femur. The nurse obtains vital signs on admission and again 2 hours. Which of the following changes in that assessment should indicate to the nurse that the client could be developing a serious complication?
A.
Respiratory rate.
Yeah, A. So we can look at the rest and see, well, they're still normal. They're still, not very changing very much. But that respiratory rate is definitely our abnormal, and so it'd be A. Nurse is caring for a client who has a T4 spinal cord fracture. Which of the following client findings should the nurse identify as the indication the client is at risk for experiencing autonomic dysreflexia?
C.
When did you say? I'm sorry.
C.
It's actually B. So autonomic dysreflexia, sometimes they call it hyperreflexia. It occurs in clients with a spinal cord injury at or above T6. It happens when there's an irritation or pain or stimulation to the nervous system below the level of injury. There are many kinds of stimulation that can precipitate autonomic dysreflexia, but one of those that we think about does have to do with the bladder. And so bladder changes, the inability of being able to empty the bladder is one of those with that autonomic dysreflexia.
And are we just read that as like, because elevated blood pressure is a sign and symptom, but distended bladder is the risk factor? That's how I read it, at least, just because they tell us that like the number one indicator of it is their blood pressure elevates extremely, but where it says risk in the question,
Right.
places it at risk instead of
Right.
saying they already have it.
Right.
Okay,
Yeah.
just making sure that I was
It puts
reading
them
that
at
right.
risk of it. Yes. Nurse is caring for a client who has meningitis, a temperature of 103.5, and is prescribed a hypothermia blanket. While using this therapy, the nurse should know that the client must be carefully observed which of the following complications. So if we're putting on a blanket, a hypothermia blanket for somebody who has 103.5, and we're trying to, I would assume, decrease the temperature, what do we have to observe for?
Seizures.
It would be shivering. So with this one, we think about the temperature is high. We're putting on a blanket to lower the temperature. We have to watch for lowering it too much. Seizures and burns we would think about, and dehydration as well, would all be if we were increasing the temperature. So with this one, again, looking at which one would be a result of lowering the temperature versus increasing the temperature. So it'd be shivering. A nurse is reviewing the laboratory results of an adolescent female client and notes her WBC of 16,000 with increased immature neutrophils, the bands, and normal monocytes. Which of the following is the appropriate analysis of these results?
A.
Yes, an acute infectious process. So why did you put that one?
Because it mentioned the immature bands, and when the body's trying to compensate and send more out, they don't take the time to complete the process of making them. It just sends them out as fast as it can.
Right, right. So we can look at our WBC count and know that it should be 5 to 10,000. It's elevated. We have increasing amounts of those bands that are out. So it's an acute infectious process. Good. Nurse is caring for a client who has a traumatic brain injury. Which of the following findings should the nurse identify as an indication of increased intracranial pressure?
Restlessness.
Yes, restlessness. Right. So increased intracranial pressure, we would be seeing bradycardia, hypertension. So we would see restlessness. Nurse is caring for an older adult client who has rheumatoid arthritis and is taking aspirin, 650 milligrams every 4 hours. Which of the following diagnostic tests should the nurse monitor to evaluate the effectiveness of this medication?
Is it B?
ESR?
It's ESR. So with rheumatoid arthritis, what we are giving aspirin for, if we think about the things aspirin does, it's an antipyretic, it's an anti-inflammatory, it's an analgesic, but we would be giving it to them to decrease inflammation. And ESR would be affected by that aspirin. Nurse is caring for a client who is post-operative following a laminectomy with spinal fusion. Which of the following actions should the nurse take? Okay, so they're post-op. So if we read through those.
Is it A?
Maintain strict bed rest.
It's actually A.
Ah.
Yeah, those patients with a spinal fusion, we wouldn't need to keep them on bed rest. What they do is they have a hard brace, like a shell brace. So we would roll them to their side and help them to get up on the side of the bed and ambulate. So we would be monitoring for sensory perceptions. And, you know, if they're working near the spinal cord, we want to make sure that there's no nerve compression or nerve damage. We wouldn't put them in a knee chest position. We wouldn't put them in high Fowlers because, again, we'd probably put them in a low Fowlers with a brace on. If you think about that comfort level with that hard shell brace on. Maintain strict bed rest. We want to get them up and move them. So usually in bed, we have them flat to head of the bed elevated a little bit. So anytime it says strict bed rest for over, 12 hours or something like that, think about what those complications might be and do we really have to do that? A nurse is caring for a client who's post-operative following an open reduction internal fixation of the fractured femur. Which of the following actions is the most important for the nurse to complete in the post-operative period?
Neurovascular checks.
Yes, perform neurovascular checks of the extremities, because we think about what complications can come from having a bone repair. And we've talked about, everything from blood clots to fat embolisms to, bleeding, all those kind of things. So we want to do some kind of assessment to determine if there are any complications. And we look at the rest of them. Medicating is an intervention, instructing is an intervention, directing them is an intervention, but performing that neurovascular check is something that is going to be giving us assessment data. Nurses caring for a client who has a spinal cord injury at the level of T2, T3. When planning care, the nurse should anticipate which of the following types of disability. Let me see what they got for that.
Is it paraplegia?
Yeah, why did you put that one?
I remember reading something about like typically when you get further up, like the C-spine is where you get into like the quadriplegia.
Uh-huh. Right. So the paraplegia is usually seen after a spinal cord injury below T1. So think about T1 and below, most likely at risk of paraplegia. Nurses in the emergency room is assessing a client who was brought in following a seizure. The nurse suspects the client may have meningococcal meningitis when assessment findings include nuchal rigidity and a petechial rash. After implementing droplet precautions, which of the following actions should the nurse initiate next? What part of the body does meningitis affect?
Is it D?
Why D?
Oh, I don't know.
No, you're right. You're right. So thinking about meningitis, we're
'cause,
thinking
like,
about the
it's-
brain and the spinal
The
cord.
meninges of the brain.
Yeah, inflammation of the meninges of the brain. We have nuchal rigidity, meaning our neck is stiff. They get that petechial rash from any type of, usually a febrile, bacterial, or viral initiation. So doing that assessment. Now, A being a vascular assessment, we're truly not looking at blood flow, at the vascular system. We're looking at the neurovascular or the neurological system. So assessing cranial nerves. Yeah.
Why wouldn't it be decreasing the stimuli? Because I know we've talked about with meningitis, they're very sensitive, so the stimuli needs to be decreased. I understand
Right.
the cranial nerves, but why wouldn't it be that one as well?
Well, if I was looking at those, I would look at, do I need more assessment or am I ready to move on to an intervention? And so this patient, we've looked at, neck rigidity, the rash, but I still want to do a further assessment to see what other impairment they have. And if they have, sensitivity to light, a headache, all those other kinds of things, then I could move on to my interventions. But I'd still want to assess before I did an action.
Thank you.
You're welcome. A nurse is caring for a client who has sustained a traumatic brain injury. The nurse should monitor the client for which of the following manifestations of increased intracranial pressure.
Is it A?
Hey.
Yeah, decreased level of consciousness, right. We would expect their respiratory rate to decrease, blood pressure to increase with that increased intracranial pressure. So decreased level of consciousness is one of the first things that we would assess for. Nurse suspects that a client admitted for treatment of bacterial meningitis is experiencing increased intracranial pressure. Which of the following assessment findings by the nurse supports this suspicion? What did we talk about before was like a key thing of bacterial meningitis?
Nuchal rigidity.
Let me go back and read the question again. So a nurse suspects that a client admitted for treatment of bacterial meningitis is experiencing increased intracranial pressure. So which of the following assessment findings?
Positive.
I think it's photophobia.
I thought it was D.
It is, it's restlessness.
Oh.
Yeah. So
Because aren't all of those other ones for, like, those are normal for meningitis, right?
right. And what it's asking for, and I think when I said that, I was it made sense to me, but I think I led you down the wrong path. With that meningitis, increased intracranial pressure. One of the signs that could show us that intracranial pressure was happening as a result of that meningitis would be the restlessness. Home health nurse is assessing an older adult client in the home who has decreased vision due to a history of glaucoma. Which of the following findings should the nurse identify as a safety risk?
Rugs.
Rugs, yeah. Scatter rugs on the floor. Nurse is teaching a newly licensed nurse about the difference between a plaster cast and a synthetic cast. Which of the following information should the nurse include in the teaching? So which one's correct?
B, the synthetic weighs less.
Yes, synthetic cast weighs less. Nurses in an emergency department is caring for a client who's bleeding profusely from a deep laceration on his forearm. After observing standard precautions, which of the following actions should the nurse perform first?
B.
Yes, apply direct pressure over the wound. So our problem is he's bleeding profusely. We want to stop the bleeding. So we're going to apply pressure. Nurse is teaching a client about medications that prevent osteoporosis. The nurse should instruct the client that which of the following medications is prescribed to prevent osteoporosis.
Is it B?
I'm sorry?
Is it B?
It's actually C. And so probably hadn't talked about too many of these. That raloxifene is prescribed for the prevention and treatment of osteoporosis. Calcitonin is prescribed to delay bone reabsorption in people who already have osteoporosis. So, I could look at these medicines and think, well, alpurinol is for gout. Levothyroxine is for hypothyroid. And then we're left with these two, but that was tricky about this one. So we're going to give it to the patient to prevent osteoporosis. A nurse is teaching a client about preventing osteoporosis. Which of the following statements by the client indicate a need for further teaching? So which one is incorrect?
D.
Yeah, reduce intake. The one that's incorrect would be reducing intake of vitamin K food. So we have to have vitamin K for bone health. So we would instruct them to intake more or continue their intake of vitamin K rich foods. So green leafy vegetables, those kind of things to promote bone health. Nurse is teaching a client who's scheduled for a dual energy X-ray absorptiometry or a DEXA scan to screen for osteoporosis. Which of the following instructions should the nurse include in the teaching?
Is it A?
I'm sorry?
A?
Yeah, why do you think A?
Well, I mean, I have never heard of this test, but I'm
Right,
thinking
yeah.
X-ray. You
Right.
don't really have to do super big things for that, but the jewelry, if it's metal, then it's gonna like impede your ability to see bone
Yeah.
stuff.
Yeah, definitely. Yeah. So it is an X-ray that is measuring kind of the density of bones as well as the length and the width of bones. And so like you said, if it's an x-ray, we don't need to lay flat after an x-ray for 4 hours. You don't need to empty your bladder before the test. You don't need to fast. But an x-ray jewelry would definitely impede the results. If anything, it might obscure something that we'd be looking at. Yeah. A nurse in a medical clinic is providing teaching to an older adult client who has osteoarthritis that is affecting her knees. Which of the following client statements indicates an understanding of teaching? So which one's correct?
A, heat or ice.
Yeah, A. I could use either heat or ice to help relieve the discomfort. And sometimes what they will advise is alternating heat and cold. Ibuprofen wouldn't be the first step in medication therapy. One of the things we think about with ibuprofen is that they could have risk for bleeding with that. Acetaminophen is really what they recommend first. It has the least side effects. Limit activity to prevent further injury. We want them to continue to have activity so their joints don't get stiff. Elevating legs by placing 2 pillows under the knees. If we're thinking about joint pain, putting the pillows under the knees could actually contribute to the development of contractures. So we want them to keep movement, but not keep those pillows under the knees. Nurse is caring for a client who has an unrepaired femur fracture of the mid-shaft. Which of the following techniques should the nurse use when performing an assessment of the client's neurovascular status? So if we were measuring their neurovascular status and we're talking about a femur fracture, which one of the things would be most beneficial?
B, palpate the femoral pulse.
Well, if we're looking at neurovascular status, we're usually thinking about the distal most point from the injury.
Wiggle his toes.
Wiggle his toes, yes, wiggle his toes. So we want to know if there is blood flow and nerve conduction all the way down. So wiggling the toes. Nurse is providing teaching to a client who has a new diagnosis of fibromyalgia. Which of the following client statements indicate an understanding of the teaching? So what do you think?
C.
Yeah, so it is C. So if I look at A, I don't think there's many things out there that are going to tell you to increase your caffeine intake. B, even if I didn't know what duloxetine is, it's actually a medication for anxiety, depression, having to have more energy to accomplish tasks. With fibromyalgia, it's more about pain. And then of course a treatment could provide a cure. Anytime it says providing a cure for something, that's a big red flag as well. So yeah, low impact aerobics. We want to keep them moving, keep the joints mobile, but reducing pain. A nurse at an outpatient surgery center is providing discharge teaching to a client and his spouse following surgical removal of a cataract. Which of the following should the nurse include in the teaching?
Is it the client should wear dark glasses?
Yeah, wearing dark glasses. So anytime we see ibuprofen, again, we want to think about that. It has a risk of bleeding. It's an NSAID, so we wouldn't want them to take that. Creamy white drainage is an indication of infection. Sometimes after attaching a new cataract, some of the things are they can have some mild drainage, and they also aren't going to have perfect vision automatically. So their eyes will take a while to become adjusted to light, hence the dark glasses. And it can become a little bit irritated. So therefore, kind of immediately after they do that, they have eye drops to put in too. Nurse is caring for a client who reports an area of redness, warmth, tenderness, and pain to the right calf. The nurse anticipates which of the following orders when notifying the provider of the finding. So what do we think about when we think about an area of redness, warmth, tenderness in the right calf?
Infection.
Blood clot.
A blood clot. Yeah. So do you know how we assess for a blood clot?
A, ultrasound.
Yeah, so a venous duplex ultrasound. And so remember as well that a DVT is only in the vein. So it has to be something to do with venous, and hence, therefore, that's why the blood clot in the vein, when it causes problems, it goes to the lungs, through the heart to the lungs. So a DVT will never cause a stroke in the brain. And a clot that is in the artery will never cause a pulmonary embolism. A clot in the artery is going to cause a heart attack. So DVT, venous. All right. Nurse is caring for a client who had a total hip arthroplasty 1 day ago and is receiving morphine by a PCA pump for pain control. The client reports nausea and vomiting. Which of the following actions should the nurse take?
B.
Antiemetic.
Are we going to assess before we do an intervention?
Bowel sounds.
Yeah, bowel sounds. Right. We want to see what could be causing it. And one of the things with a narcotic, morphine, is that it slows down everything, including the bowels. If they're nauseous, we want to also assess to see if there are bowel sounds present. So we're going to continue to assess. Nurse is caring for an older adult client who has just returned from PACU after receiving a spinal anesthetic during knee surgery. For which of the following findings should the nurse notify the provider? So which one would be abnormal? And what would, let's see.
B. Don't mind my dogs in the background.
I would say C because that's a 20 points and the blood pressure is a pretty big jump, isn't it?
Yeah. So what the answer has is C. It says that spinal anesthesia causes vasodilation. And if the blood pressure remains more than 10 millimeters of mercury below the client's baseline, there's a potential for shock. So the nurse should notify the provider for a drop in systolic blood pressure. The nurse is discussing the differences between skeletal and skin traction with a newly licensed nurse. Which of the following statements by the newly licensed nurse indicates understanding? So which would be correct?
B.
They actually had C. So skeletal traction allows for reduction and alignment of the fracture. The skin traction decreases muscle spasms commonly associated with a fracture, but it's not going to completely reduce the fracture. So the skeletal traction actually holds the bones in place better than skin traction. Nurse is teaching an older adult client who has an intrascapular Intracapsular fracture of the right hip following a fall about the purpose of Buck's extension traction. The nurse should include which of the following information in the teaching. So do you know what kind of traction Buck's traction is?
Isn't that the one where it hooks to the boot and it's like specific, or it's used more for decreased muscle spasms?
Yes, yes.
So B.
Yeah, so it's B. It's a skin traction, and it's for femur fractures. It is used on the lower part of the leg, and it is the Buck's extension traction will relieve muscle spasms. So the other ones, if we read about them, are really describing more of a skeletal traction. Nurse is assessing a client who's in skeletal traction. The nurse should correct which of the following findings.
The weights are resting on against the foot of the bed. They should be hanging freely, shouldn't they?
Yes, they should be hanging freely. So they're resting against something. They're not doing what they're supposed to do. Nurse is providing discharge teaching to a client who has plaster of Paris walking cast on his left lower leg. Which of the following instructions should the nurse include? So which one's correct?
Is it A?
D.
It's D. So what we're worried about with some of those hard cement casts are edema, especially when we're talking about the lower extremity. It's dependent. We're worried about edema. So if it gets too tight, so reporting any numbness or pain in the toes. Nurse is caring for a client who's postoperative and in skeletal traction. When assessing the client, the nurse should expect which of the following findings. Okay, so which one should we expect? What about slight pain at the insertion site? You think that's normal?
Yep.
Yeah.
Yes, yes. Serous drainage on the dressing.
A little bit.
Yeah, so that's normal. Movement of the pin at the insertion site.
No.
No, there shouldn't be any movement. It should be down into the bone. Elastic bandages secure the traction ropes.
I would think not, since they can break.
Right, right. Yeah, so they should, it should not be elastic. You can think about, what I think about is those elastic bandages is kind of like rubber that stretches and stuff, kind of like workout bands or something. Minimal edema around the pin.
Yeah.
Yes. So we've got minimal edema, which is okay. We've got some serous drainage. It's okay. Coming from the tissues and slight pain. Yeah. Nurse is planning care for a client who's confined to bed. Which of the following actions should the nurse include in the plan? So what would we do for our patient?
C.
I'm sorry, I didn't hear you.
C.
I don't want to say C.
Yeah, reposition the client. So we're going to turn them every 2 hours. We don't want to massage bony prominences. There's already a problem with blood flow and it could damage the tissue. We don't want to assess the client's skin for increase in coolness. We would hope that it would be warm. And we don't want to keep the client's skin moist. We want to keep it dry. So we want to reposition our client every 2 hours. Nurse is providing discharge teaching to a client who has a fracture of the right tibia and a fiberglass cast. Which of the following instructions should the nurse include in the teaching? So which one's correct?
C, reporting
C.
worsening pain.
See,
Yes, report any worsening or unrelieved pain. We want them to move the affected extremity. We don't want them to stick anything in the cast, and a blow dryer on moderate heat could damage that fiberglass cast. Yeah. Nurse is developing a plan of care to prevent skin breakdown for a client with a spinal cord injury and paralysis. So we're talking about skin breakdown. Which of the following nursing actions are appropriate? What would we do to prevent skin breakdown? Would we massage over erythematous bony prominences? No, we don't want to massage the bony prominences because, again, those areas get the most pressure and it could cause skin breakdown. Implement turning schedule every 4 hours.
No, it's every 2.
It's every 2, at least every 2. Use pillows to keep the heels off the bed surface.
Yes.
Yes, we want to keep the heels off the bed. Keep the client's skin dry with powder.
No.
No.
No, we don't want to use powder. Minimize
Hey, but we
skin
really do
exposure.
use that in real life.
Oh, we used to use it all the time.
We still do.
I used
Oh,
it on
do
a
ya?
patient today,
I mean, we still do.
but it
where
was
I work.
medicated.
Okay.
They're all like total cares, and they just lay and they sweat, and
Yeah.
we just powder them up.
Yeah. We used to just use baby powder, and, they don't want us to do it anymore because it can cause respiratory problems.
Yeah, and I think
Well, the one we used
I
today
did
was
have a nurse say
nystatin
that one
powder.
time that he
Oh,
was like,
yeah.
we shouldn't be using the baby powder because it's a pulmonary floor, like they already have respiratory issues.
Right.
But at the same time, we don't want them to get skin breakdown from all the
Right.
moisture that they're sitting in. So we kind of use powder, the barrier spray, and the cream. All the
Okay. What about minimize skin exposure to moisture?
yes.
Yes. Yes. So we said we would use pillows and we would minimize skin exposure to moisture. Nurses providing discharge instructions to a client who has rheumatoid arthritis and is a prescription for oral bechamethasone. Which of the following statements should the nurse make about how to take this medicine? What kind of a medicine is bechamethasone?
Steroid.
It's a steroid. It ends in ONE. Yes. So what would we tell them about taking the medicine?
Take with milk.
Yes. So it should be administered with milk or food to prevent gastric irritation. Yes. We don't want to take it with something acidic like orange juice, grapefruit juice, those things that could kind of break it down. So taking it with something like milk or food. Nurses providing discharge teaching to a female client who has neuropathy and has a new prescription for gabapentin. Which of the following statements should the nurse include in the teaching?
Drowsiness.
Yes. So gabapentin, Neurontin is a brand name. It can cause extreme drowsiness. Nurse in a clinic is talking with a client who has a new diagnosis of osteoarthritis. The nurse should anticipate that the client will require teaching about which of the following medications.
Acetaminophen.
Yes. So if we've talked about ibuprofen, the Celecoxib is like a Celebrex. It's an NSAID as well. So we want to go with the kind of the medication that has the least side effects. And so acetaminophen is always a good choice.
Dr. Lowe, I was doing ATI today,
Uh-huh.
actually. And it said the Celecoxib, but it didn't have acetaminophen as a answer. So I just made a note. Okay, osteoarthritis is a B.
Right, right.
But is it only
Salicylic acid? Isn't that aspirin though?
It just had that as the correct answer.
That it is used a lot for arthritis and pain. It's stronger than an ibuprofen. When we think about it, we think about that. It would be helpful for inflammation, but it is going to have the side effect of possibility of GI bleed. So I would say that it is a medicine that's given for arthritis, but if we're thinking and we're given the choice of acetaminophen, we would probably try that first because it doesn't have the risk of GI bleeding. And then the other medicine, that's cyclobenzaprine, that's a muscle relaxer. So yeah. And if this one, it says that they have a new diagnosis. So maybe if it was more advanced or we've tried that already, but with a new diagnosis, trying acetaminophen would probably be the best bet. Nurse is caring for a female client who has rheumatoid arthritis and a new prescription for methotrexate. The client tells the nurse she's planning a pregnancy. Which of the following instructions should the nurse give the client?
B.
Yeah, so it's teterogenic. They shouldn't take it if they're going to be pregnant. So that she should discontinue it 3 months prior to planning a pregnancy. Nurse is planning care for a client who's post-operative following a total hip arthroplasty. Which of the following interventions should the nurse include in the plan of care? What are some of those precautions that we talked about?
B.
Yeah, we want to prevent hip flexion. So a total hip, if they have the leg abducted, so kind of frog-legged out, that can cause that hip to come out. And so we don't want it to flex. They will many times put an abductor pillow, like a triangle pillow between their legs, and strap it to their legs to keep their legs from kind of frogging out. So we want to prevent that hip flexion of that affected extremity. Nurse is caring for a client who is post-operative following a total hip arthroplasty. The nurse assists the client into a supine position. Which of the following actions is appropriate to prevent dislocation of the hip?
A.
Yeah, placing that wedge pillow between the legs. We don't want the legs to cross, so putting that pillow between the legs. Nurse is caring for a client who has a prescription for a balanced skeletal traction with a Thomas splint for the treatment of a fractured femur. Which of the following interventions should the nurse implement to prevent pressure points from developing around the edge of the splint? So in this one, it's got a lot of information, and I don't even have to know what a Thomas splint is, and I don't know what a Thomas splint is. But if I'm looking and it's asking me about preventing pressure points around the edge
Mostly
of a
reposition.
splint.
D.
Yeah, so we're going to reposition them. We're going to prevent them from staying in one position too long. And that splint from causing pressure in the same area can cause skin breakdown. So we're going to reposition our patient. Nurse is providing teaching for a client who's preparing for a below-the-knee amputation. Which of the following statements is true regarding the post-operative placement of a prosthesis? So let's see if we can figure this out.
C.
This one
I
is
thought it was A because you have to like push it down to get it to prepare for the pressure.
Yeah, so it's A. It says a physical therapist will teach muscle strengthening exercises to prepare the client for prosthesis use. It has to kind of be formed into a certain shape. It's not going to be fitted at the time of surgery. It's going to be weeks to months out from that. Special pressure dressings remain on to cushion your prosthesis. They're not going to remain on after the limb is healed. And prosthesis will be adjustable depending on what shoe you're wearing. They are actually going to bring a pair of shoes to the fitting so it can be made to the length adjusted to that heel height. But the prosthesis will be permanently structured and it's not adjustable. So special exercises. Nurses teaching and assistive personnel about the purpose of a foot plate on the bed of a client whose leg is in Buck's traction. Which of the following statement indicates the assistive personnel understands the teaching? So why would we put a foot plate on the bed? Do you know what a foot plate is? Am I just old? It's to prevent foot drop. It keeps the foot in an anatomically correct kind of a walking position and prevents it from having that foot drop that causes contractures. And we know with these places, when I think about Buck's traction, I think they can't roll over, they can't get up, they're going to be on bed rest on their back. Nurses caring for a client following a right total hip arthroplasty. Postoperatively, the nurse should maintain the right leg in which of the following positions? So they had a total hip done.
A.
It's actually D.
Wouldn't it be D?
Yeah, it's abduction. So kind of that pillow that they put in there is kind of that triangle shape. We don't want them to cross their legs. That's adduction. And I think about that when legs come together, you're adding them 1 and 1 plus 1 equals 2. So we don't want to adduction because putting them together could mean crossing the legs and popping the hip out. We don't want them to externally rotate or internally rotate. So that pillow would actually abduct it a small amount. Now, we don't want them to kind of frog their legs out. That would be that external rotation, but keeping them in alignment and separated is going to be abduction, so D. Nurses providing teaching for a client who's scheduled for a myelogram. Which of the following statements indicates the nurse understands the teaching? Do you know what a myelogram is? It is actually assessing the muscle. And so with this one, it says, A, I will need to keep my head elevated after the procedure. And it says that anything that has like a gram in it, whether it's an angiogram or a myelogram, so looking at kind of the muscle sheath, is talking about looking at small tissue. So we're talking about blood vessels, or we're talking about the myelin sheath. You have to have a contrast material to do that because you can't see it just on a flat x-ray or on things like that. So they would have a contrast material, and we would keep them in kind of a semi-Fowler position with the head elevated to prevent the contrast medium, it says, from reaching the brain. So it also says during a myelogram, the client receives contrast medium. Radioactive material may be used for a bone scan, but not for a myelogram. So they would not get radioactive substance. Following the myelogram, the client should increase their fluid intake. C is talking about limiting their fluid intake. We want them to get that contrast medium out so it doesn't cause problems for their kidneys. So keeping them hydrated. So it says also expecting itching, and we don't want them to have it itching. Itching would be an allergic reaction. Okay. Nurse is assessing a client following the application of a leg cast for a treatment of a fracture. If the cast is too tight, which of the following findings should the nurse expect to observe first? They have B as in boy, pallor of the toes. If the cast is too tight, it will increase pressure on the blood vessels, impairing circulation. When this occurs, pallor of the toes is the initial finding. The nurse should immediately report his finding to the provider. So I think kind of the rationale behind that too is that the color that we see is the blood flow that goes to the tissues all the way out to the external skin. So the first thing that's going to be compressed is going to be those outer tissues that would affect skin color. So it'd be pallor of the toes.
Dr. Lowe,
Yeah.
why wouldn't the temperature change first? Like I feel like my toes would get cold before they turn color.
Well, it says that if the cast is too tight, it will increase pressure on the blood vessels, impairing circulation. Temperature of the toes will become cool, but it's not the initial finding. So I think kind of what I'm thinking about is if we're having pressure kind of on the outside in, I would think initially we're going to see changes in kind of that outside. So probably the paleness before the temperature. I think the temperature would take longer to change.
I don't know if it helps, Megan, but I just kind of thought of it as like that's how you assess pressure ulcers, like whether or not, like when you push on it, is the color going to return or not? Because it changes color before it gets cold.
Right.
Okay.
That's a good point. Yeah.
Okay. I just like I'm thinking like if if I'm not having blood flow to my toes, then they're gonna be cold. But
They are, and we can think about all of those things as correct. But when we think about which one's going to happen first, it's going to be that change in skin color. So all of those would happen. Yeah.
Okay.
Nurse is assessing a client who has a left lower arm fracture. Which of the following findings indicates impaired venous return in the client's affected arm? What do you think? Impaired venous return.
I want to say increasing edema, but at the same time, I kind of thought bounding distal pulse since it's further away because it's having no problem getting there, it just can't get back.
Right. So what we are looking at is when we think about anytime it's talking about venous, we're looking at, is it asking us to determine venous signs or arterial signs? Anytime we see venous, we're going to see changes in fluid because it's the fluid that's coming back to the heart. So edema, increasing edema. The ecchymosis or the change in skin color, the pain, the bounding pulses, those kind of things are going to be arterial. Edema is going to be venous. Nurse is providing discharge teaching to a client following hip arthroplasty. Which of the following pieces of furniture should the nurse instruct the client to sit in at home?
E.
Yeah, straight back chair with an elevated seat. Elevated meaning that they're not sitting down low because again, we don't want those hips to be externally rotated, internally rotated, abducted, and we don't want them to fall. So nothing soft or cushy or low. Yeah. Nurse in the emergency department is caring for a client who sustained a head injury. The nurse notes the client's IV fluids are infusing at 125 milliliters an hour. Which of the following is an appropriate action by the nurse? What do you think we can rule out?
Increase.
Yeah. So they got a head injury. We're worried about increased intracranial pressure. We don't want to increase it. Do we think that 125 may be problematic? I would say 125 an hour is quite a lot of amount of fluid, is a good amount of fluid. We're giving that to somebody who's probably dehydrated, post-surgery. So I would say continuing the rate, it's told us that they may have increased intracranial pressure. So continuing the rate probably wouldn't be good. The answer they had was slow the rate to 50. It says to minimize cerebral edema and prevent increased intracranial pressure. It said the 20 may compromise their volume resuscitation and cause hypotension. So they obviously wanted them to get IV fluid, but the 125 may be excessive. So they said slow the rate to 50. A nurse is caring for a client 8 hours post-operative following a total knee replacement. Which of the following actions should the nurse take? So we're looking at this one, they're post-operative, 8 hours post-op. Do we want them to be on bed rest for 5 to 7 days?
No.
No. We talked, do we want to put a pillow under their affected limb?
No.
No. What we're worried about as well is blood flow. And if we put a pillow under somebody's extremity, we could cause impaired circulation. So it could be from the knee staying bent, or it could be impairing the femoral artery. So probably not a pillow under that limb. Anytime it gives me a time limit, like cool compresses every 6 hours, I think, is there a significance about that 6 hours? To me, that seems like, it seems like kind of a random time frame.
It just doesn't tell you how long to keep it on there is what I was
Right.
thinking.
So there's something not right about that. What we're worried about as well after any type of a joint replacement is blood loss, because they can lose quite a bit of blood. It's kind of a bloody surgery. So this one is thinking about keeping them hydrated. So encouraging increased fluid intake to prevent dehydration, and also to prevent a DVT from the blood getting too thick. Nurse is caring for a client who's scheduled for an arthroplasty. The nurse asks client to state if he understands the procedure is being performed. Which of the following statements by the client indicate an understanding of the procedure? So the arthroplasty.
D.
Yeah. So it's replace the joint. It's not done to determine the joint. An arthroscopy would be going in to determine the extent of damage, where they're just going to look around. They're not going to fuse the joint. The procedure won't prevent further joint damage, but the purpose of it is to replace the joint, so it improves its function. Okay. Nurse is caring for a client who is 1 day post-op following total hip arthroplasty. It is 8:30 and the client is scheduled for physical therapy at 9. Which of the following interventions should the nurse take?
B.
Yes. So anytime we're thinking about physical therapy or getting up and walking or anything like that, we want to assess for pain and pre-medicate about 30 minutes before they're going to do activity. So identify client's pain level and medicate. Nurses working on a medical unit is caring for a client who's prescribed seizure precautions. Which of the following interventions should the nurse include in the client's plan of care? So which one of these is involved in seizure precautions?
IV access.
Yeah, IV access. So when I think about seizure precautions, I think about padded side rails, oxygen in the room, IV access, suction, those kind of things. Yeah, we want the bed in a low position to prevent falls. Yeah, we wouldn't want to put anything in their mouth. No tongue blade. All right, great job, guys. Did that seem to help some? Just kind of walking through and practicing and.
Yeah, you give those to her for the final. These are just so straightforward, like the ATI and these, like I'm doing so good on, and then the exams, I just, I don't know.
Well, when you're taking the exam, just kind of remember the walkthrough, you know, just like we do with these questions. Just think about that you printed these off of online and you're walking through these questions kind of the same way. I would say take your time.
Do you have any, sorry.
Go ahead.
Is there any, like, I don't know, she said that it was going to be really heavy on stroke.
Oh, okay.
And ICP, and there
Okay.
wasn't like a whole lot, like these are really helpful because a lot of that stuff with musculoskeletal and everything, but I didn't know if you had a suggestion on like where you got some of these, where we can look for some for those subjects, or
I would say I mean, a lot of times you can just Google, you can put in NCLEX questions, CVA. Don't know. I'm looking at my bookshelf. I'll look and see if I have some ones specific to like a CVA. I'll look and see if I have some other ones.
Thank you.
You're welcome. Yeah, when I think about CVA, I think about, because I'm teaching that in the level, kind of the mid-level in the BSN right now. We're talking neuro too. And so I think about with a CVA, time is you know, brain tissue. And so when people are brought into the ER, they want them within 45 minutes to be diagnosed. So that means, you know, you're assessing signs and symptoms, you're getting a CT scan without contrast, because you don't want the contrast to be confused for bleeding. So with the contrast, you couldn't tell if it was hemorrhagic or if it was ischemic. So CT with no contrast. You want to do the neuro exam and have that CT read within 45 minutes so that they can determine, is it ischemic? So they might do TPA to remove a clot, or is it hemorrhagic?
Because we asked her why. She mentioned in the class the other night, like why that you wouldn't do it with contrast. But we couldn't determine a reason why.
Yeah.
She didn't know the answer to that one, so thank you.
You're welcome. Yeah, that's a big determiner in determining kind of what is it. And you think about the two treatments you'd give for the different types of strokes. You know, if you gave the wrong treatment to the wrong person, if you gave, you know, a blood thinner to somebody that was hemorrhagic, you know, or if you tried to give a clot buster to somebody, you know, so the treatments would be very different, whether you had something that was bleeding and needed to be cauterized, or you had something that was ischemic and there's a blood clot in there, and you need to give something to kind of a clot buster, like a TPA, to thin the blood in that area to break it up. And so that's the critical determiner right there. I would say knowing kind of those signs and symptoms to teach a patient. What are the signs of a stroke? So the American Heart Association says face, you know, the facial drooping, the arm weakness, the slurred speech, and then an emergency, time to call 911. So, or they do fast as well, so time to call 911. But always emergent. Anytime that our patient has a has had a CVA, one of the important things that they're going to monitor and control is blood pressure. Blood pressure is huge, because if it was hemorrhagic, that area of the blood vessel is weakened, could have an outpouching or kind of an aneurysm kind of on it. So you don't want blood pressure that could rupture that. If it's hemorrhagic and they have gone in there and cauterized it, you don't want blood pressure elevated that could burst that open. So blood pressure, they want it at a level that they're going to have good cardiac perfusion, but not elevated. Let's see what else. I would say for CVA as well, thinking about safety risks. Aspiration is huge, risk for falls, risk for skin breakdown, risk for impaired mobility, knowing kind of damage to the brain between left and right hemisphere, long-term rehab. So can be very difficult for families, because, you know, it could be somebody that's been making the money for the family. What's going to happen to them when they leave the hospital? Are they able to care for themselves? Are they able to speak? Are they able to swallow? Are they able to think clearly? So rehab continues after they leave the hospital, whether it's in long-term rehab or short-term rehab, and then following up with PT and those kind of things. Very extensive care. One of the other things I talk about in class as well is something called, I can't think of it off the top of my head now, it's called prospagnosia. And so it's kind of a face blindness. And sometimes if there's injury to part of the brain, they can have difficulty recognizing people. It can also be the ability to know where their body parts are. So like if I have like a weakness or a paralysis in my arm or my leg, keeping the joint in a line. So if I have weakness in my right arm, not letting it kind of dangle there, and that could get injured in a wheelchair or on the side of the bed. So keeping it in alignment, could be keeping a sling on it, or helping them to understand that they need to hold on to that when they're moving, changing position. And then also monitoring, helping them to understand they have to monitor skin in that area. So if I get, you know, my arm falls down and hits the side of the bed or the wheelchair wheel, and my hand gets cut, I'm not going to feel that. So looking and monitoring the skin on those extremities for skin breakdown, for changes in skin temperature and color and all those kind of things. Of course, if they are have a stroke, again, like we said, risk for things like decreased mobility, and with that, increased risk for pneumonia, skin breakdown, blood clots, all the things that come with immobility, risk for patients. We still want them to have as much independence as possible. So assisting them with doing things instead of doing everything for them. That's all I can think of as far as off the top of my head, but fast assessment is going to be extremely important. But I'll look for some more questions, particularly pertaining to stroke, and get those to you guys. Okay. Any other questions about anything? I know that Dr. Columbia told me next Tuesday, I believe she is going to do a cardiac review. On Canvas, I put lots of my cardiac stuff. So at the bottom of your Canvas page, I put resources. I put my 3 lectures I use in kind of that mid-level med-surg. One of them is on basic telemetry, and it's a voiceover. I've also have a packet in there of like 20 EKG strips. So it has all the strips, and then in the back of the packet, it has the answers. And so in that course, we go over everything from the sinus rhythms to AFib, aflutter, PACs, PVCs, VTAC, VFib, asystole. And so I kind of walk through in that lecture not only how to interpret the strips, but what do they mean? So how do we treat those, and what kind of problems does that mean for the patient? And then I also have some articles in there that talk about neuroassessment, that talk about, let's see, I can think of, let me look real quick. Let me flip over there. Oh, I've got one in there that's understanding a CBC, and so it walks through the parts of the CBC. I know that's not what you guys are talking about right now, but I think it's a really good article. Simplifying neuroassessment, neuro and spinal cord injury. Let's see. And they're kind of short articles. I subscribe to like way too many nursing journals, and I really like the Nursing 2021 and Nursing Made Incredibly Easy. They've got a lot of good teaching points and things in there. And so I didn't bombard you with any of my research journals, but these have really good things in there. So I've got, again, I put together a dysrhythmia chart, and it helps me. And I think it helped my students when we went over dysrhythmia, but it has the 5 steps of things you would assess for every strip. So is it a regular rhythm? What's the rate? Is there one upright round P wave for every QRS? Does the PR interval measure 0.12 to 0.20? Does the QRS measure less than 0.12? And then across the top, I put all the rhythms. So you could look at it and see, which ones have which characteristics. And so truly, when you're interpreting an EKG strip, I used to try many times to kind of memorize them, like this one looks like this. And if there was one that looked different, it totally threw me off, until I really started embracing that 5-step, that I write down those steps and then I interpret it that way. And of course, there'll be different steps when you guys are talking about the blocks and those things. So talking about the the measurement of your PR interval and those kind of things. So you could add other columns to it and incorporate some other characteristics of more advanced rhythms, but these are kind of the basic rhythms. Let's see. And then I've got one on lab values. Thought I'd put something else in there. Let me see. Yeah, I think it was kind of just those. Oh yeah, under exam review materials, neuroassessment, cranial nerve assessment, spinal cord injury. I put in there anticoagulant medications. Yeah, I think that's it for this exam. Any other questions? Okay, guys. Well, I will let you go. I'll put this recording as well down in Canvas, and I'll see if I've got some more of those questions about CVA. Okay.
Thank you for your
Thank
time.
you.
Thank
You're
you.
welcome. Have a good night.
Thank you.
You too.
Thanks.